I should be saying welcome to the Inner Whole Uprising podcast because they really came through on this episode of Something Positive for Positive People. I was not in the best headspace at the time of this recording, but Sam was able to get the rest of the podcast hosts together to share their experiences with healthcare providers as part of the We Need a Button campaign by Dating.com group, and just talk through some of their experiences with providers. You'll hear from Sam, Akua, Rebecca, and Rob, who I met Sam and Rebecca at STD Engage, that conference that everyone was so generous about donating in order to help me get out there to. Um, the event was put together by the National Coalition of STD Directors, and Sam and Rebecca were there in person, and they were invited onto the stage to speak about some of their experiences. And Rob, they shared their story about poor health care, and that story just rocked me. And I really wish I would have just sat and recorded that and I could have just uploaded that to the podcast feed. But it was great to get all four hosts on. It was very energetic and vibrant. I had to cut myself out of parts of this and then go in and re-record me just asking a couple of questions or making comments. And so majority of it is going to be the hosts of the Inner Whole Uprising podcast talking, and you should definitely go and check out their podcast. I'm going to link to it in the show notes here. And it's, oh, excuse me, it's a podcast about dating, love, and sex from four 20-something-year-old feminist millennials who live in New York. Definitely check it out if you have, well, there's no if you have a chance to. Go check the podcast out. Shit, it's really good. Um, yeah, so I met them at STD Engage. We hit it off, and we didn't hit it off. I don't even know why I said that. We had a conversation about me having them on the podcast specifically to talk about this. And their podcast is way energetic, funny, entertaining, whereas mine's just more educational. And occasionally our guests come on and bring life to the podcast. And this was one of those situations. This was pretty heavy. It was a pretty heavy conversation that we had, but it's definitely worth the listen, and it gives you an idea of the importance of being able to determine whether a healthcare provider is queer friendly, empathetic, and just a way for us to be able to identify these kinds of things if they're sex positive. I think that that's probably the overall message here is just, are you a sex positive healthcare provider? And yes, no, then maybe you shouldn't be practicing healthcare in terms of sexuality and sexual health if you're uncomfortable with it. So, this is a third episode that was recorded as a result of attending STD Engage. So here's our live, well, it's not live, it's post STD Engage. I wish I could name it that, but maybe we'll throw that in there somewhere, especially since the kind folks at NCSD brought us together. So who knows? All right, my heater is about to come on and make a whole lot of noise. If you haven't already, please check out all of the previous episodes of Something Positive for Positive People. Like, rate, review, share, subscribe to this podcast. It's going to really help us moving forward in terms of being able to uh, just support people, man. It's really important for people to be able to access this information soon after their diagnosis. I've been getting more, there's been an uplift, an uptick in the number of people who've been reaching out to me lately talking about how they were diagnosed, and this was one of the first resources they found. So the SEO is working, the recommendations are coming in, and people are telling their friends about this resource, and I just really appreciate everyone for all of their contributions to the show. So here we go. We're going to get into this podcast episode of the Inner Ho Up, the Something Positive for Positive People podcast, featuring the Inner Ho Uprising podcast hosts about their experiences with healthcare providers in regards to not just sexual health, but I guess actual health. That's a weird way of saying that. All right, we're going to start with Akua.
All right. You have Akua. So, my last time seeing a provider for sexual and reproductive health or for testing has been quite a while. Also given because I haven't been sexually active in quite a while. Um, so we're taking this back maybe 2.5 years. I have a history with two separate providers regarding my sexual and reproductive health. First was my OBGYN, who I've been seeing since about 17, or who I was seeing since about 17 to maybe my earliest 20s. She delivered my child. I have a child. I kind of came in paths with her during my experience with teenage pregnancy. I kind of stuck with her. She delivered my child. She knew a lot of my health. I hadn't been sexually active for much longer before then. So she knew all of my medical history regarding those things. So I stuck with her. But the treatment was poor. She was a Black woman. A lot of my providers are Black women. I guess it was the run of the facility. So after giving birth, I had my 6-week checkup, which went quickly. A lot of our appointments went quickly. It lacked a lot of bedside manner, a lot of really talking with you about what's going on. Because I was a teenager, I feel like my experience was really biased. So like at my 6-week checkup, there was this discussion of birth control that really didn't involve me as an independent person. It was like, you going on birth control because you can't have no more kids. I understand I'm underage or not of an age that people find acceptable to be having kids, but I would like to be a part of this conversation. It was kind of just thrust upon me. I understood the importance of birth control and had wanted to be on birth control for as long as I became sexually active, so I went with it. Now, in hindsight, she didn't really explain all of the available options. It was kind of like the pill, and then it was kind of like, well, here's an IUD because it lasts longer. It was a very strong emphasis on you don't need to be having no more kids. Moving forward from that, whenever I did go to get testing, it was again a lot of stigma. It was kind of like, you've had a baby and now you're still having sex, and I was like, yeah, the fuck. Like, yeah, I'm gonna be fucking. You gonna do my testing. I feel like the thought process was that I was to be so ashamed that I would just stop being sexually active until an older age or a more responsible age, and that's really not how life works. So when I would go for checkups, when I would go for testing, there would be that stigma, those kind of looks, or this kind of tone in her voice, like, oh, you still fucking. And I'm like, yeah. And I would do my tests, and I remember that a lot of times I would have to follow up about my results, which I didn't seem like was good practice. My results were typically negative, so I assumed that was it. But I also feel like at some point there should be outreach, whether negative or not, that I'm getting these results and I don't have to like search for them or dig for them or go through my patient portal for them. Like, there should be another conversation about this. I stopped seeing her after I had complications with my IUD. And what is a risk of IUDs is that they can move about the uterus. So an IUD is a contraceptive device which is implanted into the uterus. And what can happen with it is that it can move throughout the uterus from placement. It can embed into your uterine lining, which is dangerous. It can move out of your uterus through the uterine wall into other parts of your abdomen cavity, which is dangerous. What had happened with mine was that mine had moved out of place. I was never really told where it had gone. But I had also had an ovarian abscess at the time, which was causing me a lot of abdominal pain. So that's what I went in for, and then later found that my IUD had also migrated. So she treated me for the ovarian abscess, and they removed my IUD. And again came this conversation to like get another one. I was like, at this time I'm a little bit more knowledgeable. I'm like, well, there are these other options that I can have, and she seemed really against it. So we just kind of parted ways following that. After parting ways with her, I did a lot of clinics. I get tested maybe every 6 months, depending on how sexually active I am, and that's not much. I just started seeing providers at a women's health clinic in my community, and I think that was the last time, or close to the last time, I was tested. I saw this provider. I stated I wanted to get tested for STIs and whatnot, and to discuss birth control. I wanted to go back on birth control and speak with someone who would give me the range of options that are out there. And as I'm sitting with him, he's reading me my results, and he's just like, well, your chlamydia is good and your syphilis is good. And I'm like, my who is what? Because this is the first time I'm hearing I got anything. And I had to make him clarify. He was like, no, I'm saying that your tests are back negative. I'm like, all right, so that is the language we got to use. I let that kind of go. I moved past that to the talk of birth control. And here again, he looked at me and was like, well, what you want? I was like, what you got? Like, what you mean what I want? Like, I was looking for real fleshed out conversations of, well, this is your age and this is your demographic and this will be what's best for you. And he looked at me like, so, like, he really asked, what do you want? And I was like, so what is out there? And I am for, client-led discussions about needs and contraceptives and medicine, but I shouldn't have to do the Googles and figure out all the types of things that are there when you have been trained and educated to do that. As part of their professional duty is to stay up to date on what is available and know who would be best for whatever kind of medication or whatever they're prescribing. He kind of threw, well, there's the pill and then there's the one they inject. And I had been kind of thinking of the NuvaRing, so I was just like, you know what? I'll take that one. And at that point, I just wanted to go. So I was like, I'll take the NuvaRing. And I was expecting a conversation about how to insert, how to remove, how to use, how to maintain. And he was like, all right, so it's at your pharmacy. Kind of good luck. And I was just like, all right, I'm going to have to go do my Googles. I'm going to have to go speak with my close friends and I'm going to figure this out. And that was pretty much my last experience. It's sad that it's kind of common in the healthcare field, even in general medicine. Talking to some providers, it's been like, so what do you think? And I'm like, you haven't given me the options. You haven't given me any information. You've expected me to come in here with an idea of what I need, and only if you agree with it, you're okay, and if not, you're like, no. What else you got? Like, what I felt was that they really didn't want to do their job. They really wanted to just get their numbers in, and you can do that labor yourself outside of my office.
So would you say there was discomfort or some bias maybe from the care provider?
Definitely. And along with my first provider, kind of checking your biases about whatever your client brings to you, because teenage pregnancy is real. People with positive test results and STIs are real. Like, and if you're in this field and you have a bias, you have to check that, because it's going to come across in the care and the service that you provide to these clients.
To someone who might have been in a similar position as where you were, given hindsight after having the experience that you've had, what would you tell someone who's in that position?
Well, first, that it is very important for your physical and mental health to get these tests done. Your physical, mental, and sexual health to get these tests done. And even if you are a bit reluctant, even if you have come across some less than qualified gems in this field, you can ask for what you need from these providers. It is their jobs to give you what you need. That is the reason for this whole exchange. So don't be afraid to go in and really discuss what you need, and don't leave until you've gotten what you need.
All right, thank you so much, Akua. At STD Engage, I interviewed a public health professional, Tessa, who stressed the importance of checking your biases ahead of time and knowing what they are, and then maybe just deciding that you may not be the best person to work with someone, or you need to do the work in order to get past those biases as a professional. So thank you for that. Next, we're going to get to Rebecca. Can you recall your most recent or a previous experience with healthcare providers?
So for me, I guess it kind of goes back a little bit, because I had just started trying to look for doctors like as an adult, where I was like, ooh, let me not go to a pediatrician anymore and let me just look for a doctor. So I found this system. I don't know if I can say the name, but the thing that I really loved about it is I've always hated the idea of like I get a test and then I have to go back and go to the doctor and be like, hey, can you give me this paper so that I can get my results, et cetera, et cetera. It can be really a lengthy process. And for me personally, I have to go to the doctor at least every 6 months because I have Hashimoto's. So they have to check my levels and make sure like the medicine I'm taking is okay. So like if I could get something that's quick, I'm doing it. So I had started with them because they everything's online. So I can just get my information. I can refill my prescriptions. I can do all type of stuff. For me, I'm always obsessed with like finding a doctor that's close within this system. Like I don't leave it. So when I first started, I was with this doctor who, when I walked in, I was pleasantly surprised because she looked exactly like me. It was a big black woman. I was like, hey, sis, what's up? What are we doing here? It was a good time. I felt really comfortable. I was able to ask 1,000,001 questions. And I felt kind of relieved just because it was just like not one. And this is something that happens, and I'll explain later why I felt relieved. Is because not one time did she mention my weight. Not even a little bit. Like, we talked about my health. I felt like I learned more about my health, but my weight was somehow not involved in that. And I can't help but notice this person looks like me. So why would we have this conversation? Because we both here. So let's do it. You know what I mean? So I tried to book another appointment with her, and apparently she's extremely popular. I understand why, because she had great bedside manner. I felt like I needed to come back. But because it's kind of like urgent for me to keep going, I can't wait for her to be available. I just need to find somebody. So I had actually ended up booking an appointment with someone who shares the office with her. So I'm thinking, oh, okay, if they're in close proximity, they have to have the same type of mannerisms, all that type of stuff. I walked in, it was a Hispanic woman. So I was like, okay, it's a person of color. So that's cool, because that's important to me. And I walk in, and it was completely different. It was very cold. I had to complain about, I think, my back hurting or something. I'm like, okay, I'm 24 at the time. My back doesn't hurt. What's going on? She's like, all you gotta do is exercise. Wait. The entire conversation was wait. So it was just like, okay, this is different. Like, it's a different thing altogether. So I had started avoiding the doctor as much as I could. I just kept refilling the same prescription that I had, not really knowing that if it was the right level, it was just working for the time. But recently, and this goes, the backstory is because recently I had to go back to the doctor because I wanted to get tested again because I had a new partner, and then they had asked me to get tested. So I was like, of course, I'm going to get the results. So I came in, and she was the only person that was available. The same person, the Hispanic woman that I didn't really like. I'd actually even called before that and said, are you sure there's nothing available? I even expressed, I was like, look, she makes everything about my weight. I don't feel comfortable with that. I just want to be able to ask certain questions and not have it be about something that I didn't ask about. And they're like, oh, we can take note of it, but it's not something that we can, guarantee an appointment with another doctor. Ended up getting an appointment with the original doctor, and then I get an email literally right before that she's leaving practice altogether because she had a family emergency. So I'm like, okay, I'll never see this person again, so that sucks. So let me just stick with who I had. So I go in, and I'm kind of mentally preparing for it, but there was a couple of questions on the questionnaire that are like different answers now. So one of the questions was, who do you have sex with? I had sex with men and women at the time. So it was like, oh, okay, well, now I have to change the answer. So I don't know what difference that makes in terms of practice or what they test for and stuff like that. I mean, I knew, but just to be, as you're supposed to be transparent with your doctor. So that's why I was like, I'm gonna just say everything. So I just put it all on there, and I went in. And I don't know why I was hoping for something else. I was, but it didn't turn out any different. I even got a raised eyebrow when she was like, I just want to make sure I'm reading this correctly because you changed this. It's men and women. I was like, yeah. And it was just like this look. And it was like when I first started with birth control with the other person, I think the reason why I keep bringing it back is because when you have a good experience, it shines such a stronger light on someone not doing what they should be doing. When I had talked about birth control before, she was just asking me, the original person, she had asked me so many questions about how I was feeling afterwards, after the follow-up. Do you think we should change it? What do you feel like? I actually had to change my birth control because one of them just making me extremely depressed. It was like I didn't want to do anything because I was taking the pill. When I changed, because they lowered the estrogen or lowered some level and they changed it a little bit, it made the world of a difference. But this is because she's like pushing and pulling information and finding out. With the new doctor, it was just like, oh, you're taking birth control? Glanced past it, didn't ask me any questions, anything like that. She literally started dancing, was like, you lost weight from the last time you were here. And I was just like, oh, it was a whole thing. And I was just like, oh, okay. I just wanted to get my test results. At this point, it's almost as if I've become so numb to it that like I know she's gonna do something. I need you to take this blood, so I don't even want to have this conversation with. If I could do it myself, because like I refill my birth control prescription on my own online now. Like I don't even want to have this conversation with a provider because it's just like if I could do it myself, I will. So this is the only thing that, like I literally cannot do, and if I need my medicine, I need it from you. So Yay, you're happy, great. And then when my levels change, she was like, that's strange because if you lose weight, then your levels, but I'm like, and I know that based off of this disease that I have, it's not only weight based. Like things can change. Like if I am under stress, that can change the levels, all that type of stuff. But it's the only thing that she's ever focused on is my weight. And that's been a thing since I was a kid. I just thought that maybe some things would change, and knowing that it is possible, it's frustrating because you don't ask me how I'm doing. You don't ask me like, hey, there been any life changes that might affect certain things? Never been a question. That was kind of my last experience. I just did it because I had to. And I only stay within the system, even though like some people be like, well, why don't you go to a different provider? I'm like, in terms of convenience, even if I have to deal with this, when I mean like I can literally press a button and get my prescription, I'd rather have that than, go through this all over again and keep having to try different doctors, even though it's not always the best situation.
All right. So do you think there's a difference based on knowledge or discomfort around sex that made the second provider focus solely on your weight? Like, is it possible that they may have felt so uncomfortable or just unknowledgeable that your weight had to be the center of attention because that may have been the only thing that they were comfortable with talking about?
I was only gonna say because I think this is based off of even talking to people when we went to SCD Engage. There's a difference. The first doctor is a general physician, but I think she's also a family doctor, the one that I had the good experience with, and then the other one is just a not just because that's a big deal, just a general practitioner. I think when people deal with like vaginas in any capacity or just like sexual reproduction in any capacity, they kind of feel like they can have more of a conversation, but sometimes people just need to go to a primary care doctor. And I think we were talking and they said that like they're not really trained to have those conversations. Like unless they want to go into that, they will, but most of the time they want to gloss over it. So I think you had said something about people being uncomfortable with sex. And I think that's a thing, like, but if you're providing this service, you're providing this STD testing, you have to be comfortable having this conversation. I mean, it's just as important as me saying, hey, like my knee feels dislocated. Can you fix this or something like that? Like, or if you're not, have that conversation and say, hey, I can recommend you to this, even though I think I don't know how that works, but even just going further, and if you know that you're not capable of having a conversation, at least having the resources to recommend me to someone else, or, hey, even acknowledge the fact that you're not having this conversation. Hey, I see you're on birth control. That's not really my specialty, but, if you have any questions about that, XYZ, which has never been a thing. It's like I see that I can see you're uncomfortable. Like I don't know why, but I'm not uncomfortable. It's my body, but I'm here. And just like, I don't know, if you're a general practitioner who's like doesn't want to have those conversations, because I think that's a choice, then you need to either not offer those services or like come with the know-how or recommend somebody who does.
What's your comfort level on a sex ed specialist for those birth control, STD tests, reproductive health type questions? I think that if we raise the standards, we're able to eliminate these unmet expectations.
Would I be Yeah, that's an ideal situation. Somebody who knows what they're talking. Can I bring in someone who knows better than me? Absolutely. Hell yeah, bring them in. Yeah, I think that would be great, of course.
All right, thanks, Rebecca. Who's next? Sam, I see you over there. You ready?
Hi, this is Sam speaking. I would like to go next. Nice to see you again. Thank you for having us. I have a lot of experiences of healthcare providers like not knowing what the fuck they're talking about. And I can tell my one anecdote, but before that, I just wanted to like piggyback on this idea of like bringing in one sex educator per practice. To me, that sounds like a good Band-Aid, but I just think there needs to be like a severe overhaul. Like there's no reason why you should be practicing if you're like, what does pansexual mean? Like you shouldn't be looking at Rebecca being like men and women as a doctor. Like you are providing a public service. That makes no sense. So like this one person who's like translating for every doctor in the practice can be nice, but what about when that one person is seeing one patient? Like what is the other doctor doing in the other room? Like these are very basic things in 2020 right now. Like what the hell is your problem? Like one, you're a doctor, so your job is to like stay abreast of new practices. So that should be something that you're doing as a part of your job, in my opinion. But also, a lot of these things, like, everybody has a phone in their pocket. Simple Google searches that they don't know. Simple Google searches. Speaking of which, here's my anecdote. So the last time this is not like the last time I went to get tested, but this is the last interesting time for the sake of the podcast. So I was informed by one of my sexual partners that he had chlamydia earlier this year. He told me that I should get tested, which greatly appreciate that. There are like sexual clinics by me, but I don't like going to them because it's like a really like days long experience because it's where everybody goes. Not that I don't like going to my gynecologist, but I find that gynecologists are really hard to get appointments at. I don't know if anybody else has that experience. It'll be like 2 months and I'm like, I can't wait that long. So I went to see my primary care doctor to get tested for chlamydia. And, you know, knowing what I know about sexual health, literally just from this podcast and the research that I do from this podcast and like interviewing people from this podcast, I'm like, okay, like chlamydia is site located. So this can be a vaginal infection, this can be an anal infection, or this could be a throat infection. I don't have anal sex, and we were having protected vaginal sex or penetrative sex. So I thought, oh, maybe this is like the case where I need to like take a pee test and also get a throat swab. So I go to my primary care, who's like not really my primary care, but I'm also a part of a network. So I'm like, okay, whatever like black woman I can get at the time. So I get a black woman, and earlier that year I had a false positive for syphilis. And while I'm telling her, like she's looking at my charts, while I'm telling her that I have like a chlamydia scare, she's like, and syphilis too? And she looks at me like I'm the worst fucking person who's ever existed. Her eyes are like wide at the screen. Like, it was a false positive, but like, first of all, what if I did have it? Like, come on, that's mad disrespectful. And then also like, I'm here to get a service. So what is the judgment? And I said, no, it was just a false positive. And she's like, oh, whew, good girl, or something along those lines. Like, what? So this is all bad, right? So I tell her the situation or whatever, and she sends me to the labs because in that facility, like, you get tested in a separate place than you do like your blood and pee test and all that stuff. So I go down to the lab, and the lab is like, here's your pee cup. And I'm like, oh, also I had asked for a throat swab. And they're like, nah, that's not like here in the chart. So I'm like, okay, can you call the lady upstairs? And the way you're reacting is very funny. That's how I felt too, though. And I'm like running around this freaking building. So they call her upstairs, and she's like, oh, no, we don't do that. And I'm like, oh, shit, I should have just went to like one of the clinics that would have taken all day, but I would have actually gotten what I wanted. Now I'm feeling like this is a waste of time if it is throat, because then I'm going to take a pee test and it's going to come back negative. And I'm like, do I still have chlamydia? I don't know. Do I have it in the first place? They hang up with her, and I'm like, can you call her back and can I speak to her? And she's like, yeah. What are you asking for? And I'm like, a throat swab, because I had only been having unprotected oral sex with this person. And she's like, throat? You can't get chlamydia in your throat. Oh, no. Which is like, 1, not true, right? 2, you can just Google it. But 3, what happened upstairs when I asked you for a throat swab? Did you just not listen to me? Like, were you too focused on the fact that I didn't or did have syphilis? Like, what is going on? Yeah, that was all really frustrating. This is the first time in a while that a partner had ever told me that like they were positive with an STI, and I was like, oh man, it just felt like bad, and it shouldn't feel bad, but you know, stigma still exists, and it's weird for me to say that because I preach like it's okay if you have STIs like on the show all the time, but I still felt bad about it, being a fucking drama queen. So just like all of the emotional experience on top of the fact that like I'm dealing with this doctor who doesn't know what the hell she's talking about, it made me feel really bad. Turns out I did have chlamydia of my vagina though, so good for her. She did yeah, she lucked out. Yeah, she she really looked out for the kid in that instance. But yeah, I have had like numerous experiences. Like that is what I talked about at STD Engage. I've had numerous experiences of me going to doctors for very specific things, like outside of the sexual health and reproductive provider space, just because it is easier to get appointments outside of those space, and time again, like people not knowing what the hell they're talking about, like with never being recommended to get an HPV vaccination, and then I ended up with an abnormal pap smear and probably an HPV infection. And even when that happened, nobody told me that there was a correlation between HPV and a pap smear. And even after, nobody recommended that I should get an HPV vaccination. I did and Googled it on my own, and then I got it like at my own free will, I guess, or whatever. trying to get on prep, and that provider asking me if I have HIV already, and me being like, that is not absolutely not how prep works. What are you talking about? Me trying to get on PEP after like a bad sexual situation that I don't really want to get into right now. But yeah, post-exposure prophylaxis. So me like going to the Akua took me actually. Me going to the doctor the next day after the sexual encounter that went wrong, and once again, it was urgent care actually, because this was during New Year's and there was nowhere else that I could go. But I wanted to stay on top of it, and I had asked the doctor for PEP, and he said, okay, cool. And he's like, he didn't say cool. He's not that bad. But he asked the nurse to come in and give me a rapid HIV test. And before the nurse came in and gave the test, or maybe when they were like letting the results sit or something like that, he's like, okay, so if the results come back negative, do you still want to go on PEP? And once again, like, that's absolutely not how PEP works. So like, how do you even have the authority to like prescribe something like that? Like, you shouldn't be working here, honestly. Like, you should absolutely know that. This is like kind of going to Akua's point of medical providers just like never knowing what they're talking about. Like, if I wanted something bad enough from an urgent care, I could get it. Like, I've said like, yeah, I have a UTI, and like not getting the P test and still got antibiotics for it. I remember one time I went to Ghana, I was just like, I need a hepatitis vaccination. He didn't do anything. He just gave it to me. No question. Isn't that weird? Like, that seems strange to me. That seems like not the way that this should be working out. And like, that is not what it should be, honestly. Like, it also reminds me of like the opioid crisis, where it's like people are telling these doctors about opioids instead of doing their due research on it, because if they did do their due research, they would see that how addictive it is. They're just like getting swindled by these pharmaceutical companies who are like, yeah, you should prescribe this to your patients, and a patient comes in and says, I have a headache, and you're fucking prescribing them opioids, and now they have like an addiction for the rest of their lives. Sorry. But yeah, it's like really messed up out here.
May I interject for a moment? So I'm a mental health professional, and a part of me keeping my licensure is continuing education. So I have to have 36 units of continuing education. I think that goes up to like about 36 hours, where in that 3-year span of my license, I have to be going to workshops. I have to stay abreast on what is happening in my field. And I know that doctors have to renew their licenses, but I don't know what goes into that. And if that's not a part of it, it should be. Like, I know it's good practice for doctors to be staying abreast on what is currently happening in the health field and what is shifting, because we know doctors be out here practicing for like half a century. You know, you would have doctors that delivered you from your mama and is delivering your babies. Like, so I don't know what goes into them renewing their licensure, but definitely it needs to be in the theme of destroying the system. It needs to be a requirement. Like, you have to prove that you're, doing this work, continuing this education, whether it's via testing or submitting. I have to submit my hours and proof that I attended these workshops and things like that. But there has to be some kind of accountability for y'all not doing the same thing you did in 1955.
Right. And that like speaks to modern advancements. But like, even now, I think this was at STD Engage, somebody told us like the unit on sexual health was very small in the first place to even like get your license to practice in the very first place. I just think that there is some sort of issue with, what is it, like bedside manner or patient care that people are not learning. Like, there are way too many doctors or like medical professionals on Twitter right now, like making fun of the fact that they don't believe their patients, when like Black women are dying at like severe rates in childbirth because people don't believe them when it comes to like Serena Williams almost fucking died. What? She's like the best athlete in the entire world. Like, no woman is expense. Beyonce almost died. What? So what me?
It shows that this is crossing against economic statuses, and that this is direct impact on race, on me as a person. Regardless of how much money I have. I was told that there are like classes and courses on bedside manners, but it's not a requirement as part of their degree. It's like an elective, and it's like an elective on how to talk to me and give me the service. Like, literally.
I mean, maybe in regards to something like that, and yeah, it kind of reminds me of like how teachers get evaluated by outside people when they're there. I don't really know how like doctors work, so I guess when you're a resident, is that what it's called? Someone might be like observing you, but at the same time you might just like switch up as soon as you're not being observed anymore. But then that also comes to, this reminds me of like what some candidates are proposing for police accountability, like a paper trail of like documentation after all of these encounters. So like what you're saying, like a survey, like if a patient were to fill something out and it doesn't go through the doctor, but it goes through like an external review board who's like, okay, like something's going off the charts here with this particular doctor. This doctor is not treating their patients right.
Also, when speaking about continuing education, because what we're talking about are two different problems that interweave. We're talking about doctors that don't know anything, and then we're talking about doctors who also don't know anything, but also don't have any customer service. So the continuing education would really be addressing the doctors that don't know anything, because we all actively or passively collect information, but when you're being forced to sit through a workshop about, new sexual identities, some of it's going to stick with you. So when your next client comes in and says, I'm pansexual, you're like, aha, I heard about that. You might still be biased, but you heard about it. We don't want them to be biased, but that is also internal work that they have to do.
I don't want them to do internal work though. Like if you're not making it to the point where that internal work is done, like if you're not a decent human being, license revoked. Fuck out of town. I don't want you to be here in actuality.
Ideally, absolutely. But like I think like Courtney was saying, yeah, how do you test that? Like people can fake it. People fake it all the time. Like
I mean, that's what I mean in terms of like patients reporting on them.
yeah, oh yeah, the service afterwards. Yeah, that makes sense. That should be a thing. I can't. Now that you asked, I'm like, why isn't that a thing? Because it's a service. Oh yeah, true.
What if there's a customer service person that's collecting the data to give the doctor to see only that data and then collect the info so that they can present a solution, or whether it be deciding on medications or some sort of lifestyle change that needs to happen, which how often does that happen? Or some other proposed solution where you don't have any direct contact with the person who's taking the data and proposing the solution, only the person who is the people person, the middleman, so to speak, who's collecting the data and making you feel comfortable to open up and share all the information needed in order to get you the best care available.
I hear what you're saying, but I think that's making too many channels for people who should just be nice, like, or just care or have empathy. Like, I get what you're saying. Ideally, like, yeah, but that's just like, that's not talking about the real problem, which is like, you are doing a job. When I don't do my job correctly, I get penalized for it. If I'm not being nice to this person, and this is in a completely different capacity, people can be yelling in your face, and you're like, oh man, I gotta be nice to this person so I can keep my job. With a doctor's office, 9.8 times out of 10, the person is there like, please help me. Like, they're not even coming in any type of way, just very open, willing to find out information. So this is just a one-on-one situation where a person's just like, I want to listen to what you have to say. And in that capacity, you're still not able to like muster up a mustard seed of like, hey, how are you doing today? Then that's too many things are going on where we're like, oh, we can make their jobs easier, but it's just like, damn, I will take what you give me as long as it's right and you're listening to me.
Like if you're interested in medicine or like drugs, be a fucking pharmacist then. If you didn't want to talk to anybody, like be a researcher. You chose to be a doctor. Like screw you.
Hello? Cool. Essentially, that just is a bigger Band-Aid. So it's like a larger Band-Aid than the sex educator. It's like bare minimum. The thing about doctors is that they go through so much school to get to where they are. The least you can do is do your job and also do it well. You don't, it's not like you're working so much money. Now granted, yeah, okay, cool, congratulations, you got a whole lot of debt. It also be like that sometimes. But it's not like you work at Forever 21 where, no offense if you work at Forever 21. However, the goal for Forever 21 is to sell clothes, not customer service. You should know that when you go in there, everything is fucking everywhere. That's Forever 21. The doctor's office, it's customer service and customer care. You're caring about an individual. You're caring about their needs. So you also need to be compassionate about their individual circumstance. You also need to be able to, we all have biases. Yes, we all have internalized biases that may impact how we think. However, you as a doctor, you have to have the strength to look past your biases and take care of your patients. So you don't walk around putting these biases on everybody else who has to deal with you because it's not their fault. They didn't ask for you. 90% of the time, people don't fucking ask for these doctors. They just pull up. You make an appointment, and you walk in, and you're like, okay, that's the doctor I'm getting. And it's 9 times out of 10, it also ain't the doctor you're gonna get next time if you are in a network. You don't even have any continuity. You just be seeing mad random people and shit. And then also makes you uncomfortable because now I have to start from scratch. So I know I already told this doctor everything. I have to tell you everything. But how are you going to react? This doctor reacted this way. Are you going to be the same way? Are you going to be different? Like, do your fucking or pay me. Pay me to do your job. I want some figures.
That's a fact. If I have to Google what my symptoms are and tell you what I have beforehand, cut me a check back. Yeah.
Whatever the insurance is giving you, give it to me.
Just slide it on. Slide it on.
I'm keeping my copay and 10%. Stop.
Let me get it. I'm poor.
I am broke.
If I wasn't so poor, I'd be probably going to a better fucking doctor. However, we got broke nigga insurance, which means that we get the bottom of the barrel, unfortunately. I don't have access to high quality care, and even if I did, they'd be still trash. But at least with the other bigger or more specialized practices that you don't that you need referrals to go to and stuff like that, also there's a lot more reviews on those people. So I can it's easier for me to find out this person's good, this person's trash, this person has a longer wait because it's like a person thing. When it's a network, it's just a network. You can't really find out about these individual doctors. It really trickles downhill where you just have to go with what your insurance gives you and hope for the best. You can't request a certain doctor. Like, you half the time you can't request the person at the nail salon. It's just like you get what you get. So
I want to add something, kind of piggyback off what Samantha said. I think the issue is not adding more people into the room. The issue is going back to the basic training. Like Sam said, if you get to the point of licensure and you not good, you out the paint. That was really a part of my training. What was really harped on in my graduate program is knowing your biases, knowing how to build rapport with clients, knowing how to speak with clients, knowing how to de-escalate things. And that's where we have to go back. Once you hit medical school, once you got that acceptance letter, it needs to be a part of their curriculum. It does not need to be an elective. It needs to be mandatory, at least 3 classes. And then when you're a resident or you're a fellow, whatever else comes afterwards, that needs to be a part of that review, that supervision, that whatever. I'm at a loss for words, but it needs to be a part of what they're observing when you're as an intern, when you're doing your fellowship or you're doing your residency after you finished all the education piece. Whoever you report to has to be able to say, you know what, they got a great bedside manner. Check that out. And if not, they're like, yo, you got to sit with us for 6 months. Whatever it is. Like, it has to be, it cannot no longer be an elective or, maybe I'll take it. It has to be the requirement. It has to be the standard.
We need to incentivize change by hitting them pockets. I mean, I get tested at a nonprofit, and my goal is to increase their visibility because it's such a good service that it deserves to be uplifted. I feel comfortable when I go there. I don't feel judged. I feel like the people who are asking me the questions that they're asking me are genuinely concerned for how they can best provide the absolute best care for me. And on my end, I just need to be honest with them. Like, they recommended or they asked me questions to decide whether or not I was a candidate for prep. So Sam, kind of going back to what you said earlier about having to ask for prep rather than you having to go in and ask for it. They're asking me the questions to determine I guess my risk factors and decide whether or not I'm a candidate to be on prep. And I even asked, why'd you ask? And they talked me through the reasoning behind it as well. So it's really important for us to be able to increase the visibility of organizations like this that do a genuinely good job.
I want to add something, and then I want Rob to share their piece. It's nice to, highlight those that are doing the work well, but when the problem is ubiquitous, when the problem is everywhere and we use that model, those good people get burnt out. They can't see everybody.
That's another good point. A good provider is hard to come by. So we're cutting close on time, and I said 90 minutes. It's close to that now. Rob, before you start, I wish I would have just recorded your video at Engage. This is what We Need a Button is really aiming to combat all of those experiences that you shared in the video, and I know that had to have been draining on you. So, if at any point you need to take care of yourself through this, or even immediately after, whatever, please do what you need to do in order to take care of yourself. But I just really appreciate that you were so willing to put your story out there, because this is really going to be something that helps move the needle forward in terms of us getting better health care, accessible to getting better overall health care. And that empathy is such a crucial element to this, and your story really highlights the importance of even the slightest bit of empathy.
You're welcome. Oh, hold on. Boom. Okay, well, thank you. I really appreciate that, because that video took a lot out of me. Like, this conversation probably will take a lot out of me, but here I am. So my last experience with a sexual reproductive health provider was through the VA. So I am a veteran. I also have a history of HPV. That's like been my best friend. Me and HPV go together like sugar and cereal. Oh, Kool-Aid. There you go. So I went to like a regular gynecologist outside of the VA for a general vaginal health checkup. So I got tested, and I also had a pap smear, and my pap smear was abnormal. And I didn't want to go through the VA. I just wanted to go to a regular convenient doctor. However, with my insurance at the time, there was only a couple of gynecologists that I can go to. Even fewer did colposcopies. So I had a 2-month wait for a colposcopy, and I didn't know what was going on. It could have been as far as cervical cancer, because I didn't have a pap smear in a long time. It could have been as small as lesions, benign lesions. It's something that I didn't want to play with, as I had precancer before and had to have surgery. So I went through the VA, and I just gave them my results, and he's like, oh, all right, cool. You definitely need a colposcopy. He did my colposcopy with no issue, so that was really nice. But then that came back positive as well for high risk cells that there was a good chance they could possibly turn to cancer. So I needed a leap. So I went in for that. So that experience was, he kept telling me how it wasn't painful. The thing is that I had a provider with a penis, did not have a vagina, definitely didn't have a cervix, but he kept telling me how the leap would not be painful, how the colposcopy was more painful than the leap. The first thing, I was also very nervous. Of course, that's a common thing before any surgery. Being nervous is a completely reasonable reaction, but my nervousness made him nervous. That's what it seemed like. He didn't offer any reassurance. It was very, this is what's going to happen. This is what's going to happen after. But there was no empathy at all within the situation. Luckily, there were some Black women nurses that came into the room, because I was so scared that I was crying, but like sobbing, and like when you convulse when you sob, like my whole body shaking. And then I was also fucking cold. It was so cold in there. They had to like bring a personal heater. I got my legs open, about to get my cervix zapped, and they have no heat. But it'd be like that sometimes. And he didn't warn me about the pain that is associated with anesthetic going into your cervix. That is the most painful thing I've ever felt in my life. Because, your cervix got nerves, bro. That's a big-ass needle that they're putting in there, and then they're injecting liquid into it that does not go into it. And he just, when I say no reassurance, it was like a dentist. When dentists just be fucking your shit up, but it's just so normal for them to cause people pain. They're so numb to it. But I feel like with reproductive health, there's so many different layers, physically and psychologically, that you have to have some kind of empathy. Like, this is my cervix you're talking about. This is when my future child's going to get pushed through, and you're talking about surgeries on top of prior STDs. So now I'm worried about my reproductive health. I'm nervous about, will I be able to have kids? You're not telling me about the risk associated with it. I knew there was a risk. He didn't advise me on the risk associated with it. There is definitely a risk with the leap when it comes to having children, low birth weight and things like that, because you're removing a piece of the cervix. But he almost made me feel like I had no other option, which I feel like I probably did. But as we talking about, why do I have to do all of the research? I am not a gynecologist, and my job is to trust you. But I go get my anesthetic, still crying, but, of course I'm not in pain as my cervix was numb. But he didn't explain, exactly what was going to happen. I actually had to Google, watch videos, and just do a lot of research about what the actual procedure was. So when they put this pad on me, luckily, like, I'm an IT specialist, so I knew that it was a grounding pad, which was like a wild thought. But like, they're just putting shit on me and I have no idea what they're putting on me. I realized after me, when I was done freaking out, like, oh shit, that was like really electricity. They use electricity to remove the cancer cells. But I had no idea what was going on. All he kept telling me was, it's just going to be a little uncomfortable, but it'll be fast. 15 minutes in the cervix is not fast. That is a very fucking long time. It felt like forever. And I had to keep as still as I could. But when I tell you I was just crying, I cried the entire time. And I'm very thankful for those nurses, because they got me a blanket and they were just like, being very motherly, like rubbing my back and rubbing my head and telling me it's going to be okay. I'm doing so well. I'm doing, I'm so strong. It was so appreciative, because all you get is the anesthetic on your cervix. I wish they would have gave me a fucking Valium, but he was so impersonal to me. He's a white man, older white man, probably like in his mid to late 60s, but he just didn't give a fuck at all, especially knowing that you're treating veterans who, like, I literally at that time I just came back. It was like a few months after I came home, so we already pretty messed up when we come home from just trying to deal with that transition, being home, and then I have to go have surgery. So to end the experience, so with the VA, any prescriptions, anything that they prescribe me, I get for free. So I knew I was going to be in pain. And I asked him and I also get chronic yeast infections and like BV. But I figured that I probably wouldn't have BV, but definitely a yeast infection. So I asked him, can you prescribe me 2 diflucans? And I'll take one today, and I'll take one in 5 days. That's usually how I do it, to just control the flora so it doesn't, grow out of control. Because I know that. I know my care when it comes to my vagina in that sense. And he hesitated. I'm like, well, the thing is, if you don't do it, then I'm going to have to go back to the doctor to do this, or you can just give it to me, or I'm going to have to use a suppository if I can't get to the doctor, but I shouldn't be putting anything in my vagina because I just had surgery. So please give me the fucking diflucan. So he gives me the diflucan, and then I also asked him for Advil, because, you can get over-the-counter Advil, but A, you can only get like 200 milligrams without a prescription, and B, I didn't have any Advil at home. I don't really use Advil. I knew that would help with the pain, and he didn't say this to me. He said this to one of the nurses. Oh, why can't she just buy Advil? Advil's at Rite Aid. Advil's there. Advil's that. Like Advil's so accessible. Yes, it's accessible, but also at the time I was fucking broke. I wasn't trying to buy Advil where I was going to go through the whole fucking bottle trying to get rid of these cramps when I knew that I can get it for free. It was very classist of him to judge just because it's something that he could afford, that was something that I could afford. Because let me tell you, Advil ain't fucking cheap. Even like non-name brand ibuprofen is not cheap. And you really don't want to have to take half a bottle where you could just take one pill and be good for the rest of the day. And I also shouldn't have to explain that to you. It's not coming out of your pocket. So anyway, that's my experience with my cervix. I mean, in general, my experiences with sexual and reproductive health providers just hasn't been great. I've had one or a couple of really good gynecologists who respected me, who listened and guided me with different options so I could kind of tailor my own healthcare. But a lot of my experiences were very judgmental. Only recently I've been asked who I have sex with, if I'm having sex with men, women, or men and women. The first time that's happened to me was last year, and I've been having sex for almost 15 years. Depending on who you have sex with, what kind of genitals they have, STDs vary. You know, there's higher STD rates for people with vaginas who have sex with people with vagina for certain STDs. It doesn't all fit together, but if you don't know who I'm having sex with, you just know I'm having sex, you might not test for these things. It just doesn't occur to you. But that's also with coming with knowledge that doctors, a lot of doctors, gynecologists, they're not taking the time to ask the questions. And even if they do ask the questions, not taking the time to understand what those answers mean. Yeah, this should be rough. I don't enjoy going to the doctor for any kind of vaginal thing. And until recently, I was very sexually active. And I can't say that every time I was having protected sex. Sometimes I thought I was having protected sex and I wasn't. And when I would go to get tested, a lot of it was an issue. Why are you having so many STD tests? Damn, because I don't want to have STDs. That's crazy, you know? And a lot of the times, actually almost every time, I haven't had an STD in almost 10 years, but I've been tested a billion times. So my tests come back negative. But the fact that I have so many tests is alarming to doctors. They're wondering why I'm getting tested so much. And instead of just asking me, you know, bare minimum, instead of judging, but saying, are you having protected sex? Is it that you're having unprotected sex? Why you're getting so many tests? And go from there, like maybe I can help this person, counsel this person on better sex practices, different kind of contraceptive methods and barriers, making sure they understand that birth control doesn't protect you from STDs, STIs, making sure you understand that HPV, even if you wear a condom, you're still likely to get it, that you can get STDs in your asshole, like, you know, trying to counsel you through all the different things. But a lot of that is lacking. It just became a lot of judgment. And that really makes you not want to keep going back because you think you're doing the right thing by trying to take care of your body, and they're telling you clearly you're doing the wrong thing. Like, I'm not going to not have sex, so I'm just going to get tested less so I don't have to deal with that stigma. I mean, all right, I'm done.
Just to piggyback off of what you're saying, I think I realized one of the issues is there used to be a time that doctors were the end all be all for everything. I think there's this antiquated that belief that is just like, all right, I'm a doctor, I'm gonna come in here and whatever you say, like, I'm gonna just fuck with it. Because it used to be I couldn't pick up my phone and Google something, or, you know, I'm not gonna pick up this encyclopedia, I'm just gonna go to the doctor and whatever they say, I'm gonna do it. I had went to a doctor once and they just touched my stomach because I said I had, like, I think I was constipated or something. They said they touched my stomach and prescribed me something that literally had like at least 30 cases of like malpractice or whatever, because it was giving people like kidney disease. And I'm like, you did not perform any test of any kind. You touched my stomach and said, I'm going to prescribe this for you. And had I not taken that extra step to go and Google it, which is like something at one point in time nobody could do, I can see why shit was getting messed up. You know what I mean? So I think that comes down to everything. It's just they're not used to being questioned. It's like, I'm just going to say whatever I have to say, whatever I feel is right, or this, that, and the fourth. And for people, like, for instance, when that person was there for like 60 years old, he's probably been doing it for 40 years. You become numb to it. You're not doing anything. You're not thinking about anything new. You're just used to no type of resistance to what you say. And that type of power can just kind of make somebody an asshole without thinking about it, because they're just like, I can do whatever. I'm a doctor. You're going to believe whatever I say. And I think that's where the problem is coming up, because now we're questioning it like, nah, like, if I'm kind of scared now because people are dying, people are getting hurt, people are doing all this type of stuff, and I'm going to question it. But if they aren't scared of that, if they're not scared of that and they just think they can do whatever, that's what the problem is. It's just like I'm a doctor. Come on. You're going to believe me.
Yeah, I've had many experiences where I felt like the providers wanted me to just believe them and get out of the office. So I have now, because I have a degree in human biology, and a lot of the things that I learned was people don't believe black people, black women, black people with vaginas. They just, whatever they think is right, and whatever you feeling is not valid. So I make sure that I take a lot of time to ask 1,000 questions. I want to make sure that you understand what I'm saying. I want to make sure that I understand what you're saying, but it also holds up the line, because it's like 10 people outside and they want to get to the next room. They want to get through as many people as possible. Now you're not on schedule, but that's on you to make sure you have enough time with patients. So if that does happen, that you're not frazzled, because I don't want to feel rushed in this process. I've been told, because, with antibiotics, I am susceptible to yeast infection. So just like I asked for diflucan in another setting, and I was told to drink cranberry juice. I was told to drink cranberry juice to prevent a yeast infection. And it was like, so many levels of like, how did you come to this conclusion? It's so many levels. It was so silly. It's such a silly thing to say, especially in a healthcare environment. Like, cranberry juice, I would have eat cranberries. I probably would have taken that. Like, I mean, it's still like, two different parts of the vaginal area, but I would have been like, okay, maybe you got confused, but drink cranberry juice, which has like 5% juice. But okay, whatever you want to say. Or I've been told that my vaginal pain wasn't severe enough to warrant anything stronger than Advil. Well, actually, ironically enough, the UTI thing, or the yeast infection UTI thing, was a woman, but she was a white woman. But with the pain, actually, no, with the pain, a lot of it was men, people with penises, but a couple of times it was also white women. But I'm telling them that the pain is so severe that, I mean, when I tell you I can't walk sometimes, like I have to sit with my legs open, I can't wear underwear, I'm in excruciating pain. Sometimes the only thing that numbs the pain is alcohol. And I'm asking them, can I have something stronger than Advil? No, we don't prescribe anything stronger than Advil for vaginal pain. So if I break my fucking arm and it hurts just as much as my vagina, the fact that it's my vagina, I can't get prescribed something stronger. I'm not trying to be out here taking mad opioids for no reason. However, I need to function. I cannot walk because my pussy hurt. So I've been prescribed Tramadol before for my vaginal pain, and it worked wonderfully. I only took half a pill, and I was able to get about my life. But I had to fight for it. I had to fight for it so much, I had to hoard it. And I still have it, because sometimes it gets bad, and I have to take one. And I shouldn't have to live my life like that. I'm gonna take care of myself tonight. Because talking about this, honestly, when I made that video with Sam, I was okay. And then I went home, and I was so sad. And I think before we recorded that video, I'm talking about the video that we made for STD Engage. Even before I made that video, I started experiencing a lot of anxiety, and I didn't realize how the care that I got with my sexual health, how much it really impacted me, to the point where I was like physically anxious. I recorded the video, hung out with Sam, watched some anime. I went home to do whatever I had to do, and I was so depressed. And I cried, and I was miserable. And I think at that point, it even led me to suicidal ideation. And not to say that point triggered it. I had a plethora of other things going on, but that added so much to it, just having to relive the things that doctors have told me and the shame that they put on me just trying to live my life and trying to be happy. I think I'm strong enough to be okay today, but if anything, I'll text my counselor.
All right. This concludes this episode of Something Positive for Positive People. Please like, rate, review, subscribe to, share these podcast episodes. It means more to us than anything else. Just getting this content out there, and it helps us with getting higher numbers, getting these stories to the people who need them the most. And now the overall big picture mission is for us to be able to provide therapy and pay for it for the people who find us, however they come across us, whether it be via a herpes diagnosis or a positive STI, or if they're experiencing a traumatic event, or belong to a stigmatized group find their way here and decide that they want to take the next practical step in healing through their shame. This episode specifically touches on the issues that we face in the healthcare, in the public healthcare field. And these stories are so critical because not only do they harp on the client patient perspective, but it's also the care provider. I think that this is something that really shows them that this goes on, and people are going to share their stories. Like, we have here an accountability piece, because we can't just continue to allow people to get away with dismissing someone's pain, or not being as informed as they should be, or not acknowledging a person's identity, or just overlooking the person and looking at them as a number or as a symptom. And each and every one of these We Need a Button stories, and you can head over to waxo, waxoh.com, and check out more of these stories. But this is just something that I'm hoping moves the needle in the direction of having a way for people to recognize that their providers are going to be sex positive, queer friendly, empathetic, and genuinely just good people. And like we said earlier, like, the bare minimum is that you do a good job. So I want to thank the Inner Whole Uprising podcast for making the time to come on here. Sam, Rebecca, Akua, Rob, y'all are great, and I so appreciate y'all having taken the time to bear with me. I was going through a real tough time when we recorded this podcast, and I talked to Sam about everything that was going on, but you all were great. Y'all carried this podcast episode. I had to literally go back and record my voice alone now that I'm in a much better place, and plug it in there in these strategic spots where before, like, I wasn't really present. I was asking questions. It was just really uncharacteristic of me. So I'm very thrilled with how this podcast turned out, and I definitely paid for it with editing time. I think it's best from now on that if I'm having a bad something, that I just not record, or postpone or reschedule. But these podcast hosts were amazing. I strongly encourage, if you are hearing this episode, that you hop over and subscribe to the Inner Whole Uprising podcast. All right. If you want to get in contact with me, I'm on social media at H on my chest. I'm really I'm really distancing myself from being on social media so much. I'm going to be starting yoga teacher training here. Well, by the time this is released, I will have started yoga teacher training. So I normally do a lot of the podcasting stuff in the middle of the day and on the weekends, but the middle of the day is going to have to be dedicated now to doing more of my work stuff, personal training, and working on yoga stuff that I want to get in place. So yeah, the podcast is still going to release on a weekly basis. It's just my involvement on social media won't be as heavy. So if you need to get in contact with me right away, visit SPFPP.org. You can contact me multiple ways there, or you can just email me directly, Courtney@SPFPP.org. Till next time, stay sex positive.